The Global to Local initiative started with a conversation, talking about ways that we might learn from the work being done overseas that could improve our healthcare system here.
I see Global to Local as a collaboration amongst 4 organizations, all with the goal of helping the health of a community improve.
We're at a point in healthcare now where we know the old model cannot sustain itself. And we asked ourselves simply, why haven't we ever combined the remarkable innovations that we've taken to developing nations and bring them home?
The idea is a simple one, which is let's take what works in other places and apply them here. But it's interesting in that it hasn't happened.
Seattle and Washington State are considered the nexus of global health activity in the world. And to me, it would be the height of irony that we are improving lives so dramatically in other places in the world, but ignore what's happening in our own backyard.
Literally 5-10 miles from downtown, we have communities that have health statuses on the level of communities in Africa.
The realization that some of the greatest disparities from the wealthiest and the poorest in our nation can be found in South King County was a full indication that we were on to something important. The particular community that we're focusing on in the area of SeaTac Tukwila is largely at or below the poverty level.
The most diverse zip code in the entire country is just a couple miles south of Seattle.
The SeaTac Tukwila community is a very vibrant community with a whole lot of energy, and a lot of that energy is focused around the need for its own community development.
The local governments of SeaTac and Tukwila are as good as they come.
So a key part is engaging community-based organizations, engaging the leaders, the drivers that can make things happen.
The communities we take care of have real disproportionate share of chronic disease and lack of access to care, and lack of access to other kinds of public services that many of us take for granted.
You really can't eat well if you don't have healthy food at your corner grocery store.
You'll see people walking along the edges of the roads. People walk miles to get to the grocery store or to get their kids to school.
We see the problems that are caused by social inequity every single day.
So our job is to try to create a systematic approach that allows these people to become successful. Our idea was that we would create an initiative. Now, this initiative doesn't have 4 walls at the moment.
This program is truly in evolution.
It's a lot more creative than one might think when one hears the word entity or organization.
This is a truly holistic approach. You know, traditionally we think about having to go to a doctor's office.
Care is a very broad concept.
Whether that is physical health, mental health, economic health, educational health.
Most people think about great health care as technology, a big CT scanner.
In some ways, that's constrained us all into thinking that anything health-related needs to go through a hospital or a highly expensive healthcare system.
We anticipate that we'll be applying some of these global health strategies that we know work in other countries. Things like community health workers. We have people within the communities who can act as ambassadors and educators about where to get services or what types of services you might need. High-tech interventions as well, mobile technologies. We want to educate young people so they can help educate their parents. It's important to think about economic stability, housing and transportation, better nutrition. All of those are components to improving health outcomes.
When we look at bringing global to local, it doesn't mean coming in on a horse and saying we've got all the answers.
We have elected to take the broadest possible notion of what care really means and put our ideas to work.
This project isn't a one-way street. This isn't just about public health and Swedish and the Global Health Alliance and Health Point helping this vulnerable community. We will learn so much from them as well.
When one looks at indicators of need in various communities, they are statistics. When we engage with the people in our communities, those statistics come alive.
To me, this represents simply the most important thing that I've done in a long time.
Not only will it benefit these individual communities, but really has the potential to serve as a model.
It's a great thing to make people better, to raise the health status in our community. But quite frankly, it's the way out of our trillion-dollar mess in healthcare.
We have so many people who are invisible, and it's essential that we do something about it. This is all about the rising tide lifts all boats. The more that we can help people help themselves and do well by doing good, we all win.